Hello and welcome to World Talks here on TVP World with me, Ashim Kumar. Now, mental health disorders caused by planetary effects such as droughts, heat waves, storms and floods. Perhaps new to us, we very rarely hear about this issue, but serious enough for the European Union and the World Health Organization to hold two conferences on the subject and to demand urgent attention. What's it all about? What's causing it? Why is it different? And what can we do about it? Well, to answer those questions, we're joined by Mr. Tadeusz Hawrot. He's Executive Director, Psychedelic Access and Research European Alliance. Welcome, Mr. Hawrot, to TVP World. Thanks for taking the time.
Thank you for having me. Hello.
Hello. So I mean, why now are we beginning to recognise this psychological effect of natural phenomena?
Yeah. So it is true that we are observing that mental health conditions haven't been really properly recognized in the past. They are not exactly having the similar degree of priority that we see with other conditions such as cancer or cardiovascular diseases or pandemics for that matter. I think one of the reasons is still that we see a prevailing stigma that is surrounding these disorders. So I would say this is one recognition. This is one observation. What's also challenging is that brain is a hugely complex organ. Some say that it's the most complicated and complex structure in the universe, and it's difficult to really sometimes understand what's going on in the brain and what's going. What are the problems and diseases caused by the brain? So I think that. Perhaps we can speak about this combination of a stigma and the complexity of the brain, which makes it more difficult for scientists to understand how to fix it when something goes wrong. And this applies, of course, to mental health conditions as well.
Understood. I mean, mental health conditions, as you say, have been, not well understood, recognized in the past, but that's changing, isn't it? I mean, for example, work-related stress related to finance, depression. I mean, the pharmaceutical industry issues billions of dollars worth of antidepressants to its customers. I mean, that's been around for decades. So what's so different about these mental health issues?
Mm-hmm. Yeah, so as you observed, we see a positive change, luckily. Especially as we are kind of speaking maybe about the WHO Europe and EU. I just came back from Geneva yesterday from the WHO Mental Health Forum, which was marking the Global Mental Health Day yesterday. So I have really observed that there is an increased interest both in terms of international organizations and member states, in terms of recognizing the challenges we are confronting with mental health. And in the EU, more specifically, last year was absolutely groundbreaking because for the first time, all the major EU institutions really recognized that there is a challenge that we are having with mental health problems. There was as you mentioned, a comprehensive approach to mental health. This is a strategy released by the European Commission. We've seen a dedicated report on mental health in the European Parliament and also Council conclusions. So EU Council bringing together 27 member states. At the same time, even if there is this growing recognition, I think we don't really do very well in terms of providing more therapeutic options to people affected by mental health conditions. When you look at it's called the pipeline, what's kind of in the pipeline, what's being researched currently in this space, in the central nervous system diseases, 80% is neurology, 20% are possible new therapeutic options for psychiatry. Now, just to give you a further context, in the last 3 years, the European Medicines Agency approved 89, I think, new treatments for oncology, for cancer, and only one for psychiatry. So I think that there is still a lot that we can do to improve this kind of research landscape.
Understood. I mean, that I suppose shouldn't come as a big surprise to anyone. We live in stressful environments in many ways. One of the biggest stresses recently, of course, have been the COVID lockdowns, where mental health issues exploded. Children weren't able to go to school, so they couldn't engage with others. And of course, there's an increase in alcoholism, domestic violence, all sorts of. What, if anything, was discussed with regard to those challenges linked directly to the COVID lockdowns?
Mm-hmm. Yeah, so I think that it's clear that COVID and lockdowns really exacerbated the scale of the problem. We have seen a steep increase in the prevalence of mental health conditions, which then stabilized and dropped. But of course, COVID really contributed to a significant worsening of global mental health, really. So I think this was one of the reasons behind a significant increase in priority that we have seen going to health and also mental health in the European Union. There was a more than a tenfold increase in the EU budget going for health after COVID. But what's really worrying, and of course mental health is benefiting from this, but what's really worrying is that we very quickly forget about these lessons. And a few months ago, there was a cut. 20% of the health budget, 1 billion, was cut and redeployed to help Ukraine, just like with other budget pots. And, and this is needed, but I think the challenge is that proportionally, this was the biggest cut that we have seen across different EU budgets. And this will unfortunately affect the funds that are going to mental health. So, there are reasons to be optimistic, but there is much more than we can do. And I'm really encouraged to see especially how much importance is given to this topic in the European Parliament. And earlier this week in Strasbourg, we also have seen that
Indeed. I mean, clearly mental health is going to influence the output of the population in any country, and so it needs to be addressed for that, and of course other reasons. Now, what are the solutions that are being proposed? Is it purely a matter of issuing pills, pharmaceuticals, or is there something else? And if so, what?
Mm-hmm. Yeah, certainly we shouldn't be looking at mental health only through biological lenses, through the kind of brain abnormalities. This is part of the story, but it's far from being the whole story, because mental health conditions are not like physical conditions, like some problems with enzymes in our liver. They are the problems of societies, of lack of connection, of our difficult life trajectories, where we are affected by trauma, by the social disconnect, by the crisis that we are observing now, for instance, with youth mental health. So I think it's really important to create environments that are more conducive to good mental health and well-being. You mentioned, for instance, a workplace. This year's World Mental Health Day is focusing on workplaces, and we know that there is an epidemics of stress and perhaps not always very healthy work environments. So first and foremost, what we need to do is really see how we can create environments that are more conducive to mental health. So really look at access to health prevention. And then, of course, we shouldn't forget about people who are already affected by mental health conditions. Sometimes they will need psychological support. Sometimes they might need pharmacological support, and that's where also my organization is active. So there has been an increased scientific interest in psychedelic therapies as as one additional option that we could have for people affected by mental health conditions. And here, psychedelic therapies are unique in that they are bringing together pharmacology and psychotherapy. So they are not only another antidepressant where you kind of swallow a pill, but they are really experiential treatments which engage people. So there are, for instance, now around 30 clinical trials in the EU looking at these substances. So this is the treatment side. And then what's really important also with mental health is the kind of aftercare and reintegration of people during their kind of healing journey into society after recovery, and the mental health services that are really focused on recovery, that are focused on community-based approaches and mental health services. So I think there is this whole spectrum across the life continuum that we need to be mindful of when speaking about mental health conditions.
Understood,
like
and that of course makes perfect sense. Once somebody has gone through treatment, to be reintegrated into society makes perfect sense. Now, in the last minute or so that we have left, Mr. Hawrot, now children and adolescents come up in the list of vulnerable groups. Why is that? I would have thought they'd be more resilient, wouldn't they, to things like, I don't know, heat wave and storms?
Mm-hmm. Yeah, this is something perhaps that is the most worrying aspect of what we are discussing here, because now suicide is one of the leading causes of deaths among teenagers. So I think depending on the country, it's either the second or the third leading cause of death in the age group of 15 to 24. And in fact, 75% of mental health conditions, they start before our brains mature. So they are the diseases of the young. And I think when we first of all, when we listen to youth, the main problems they mention there are three. One is climate crisis, the other is their employment prospects, and the third one is mental health. And unfortunately, I sometimes feel like our lives don't belong to us. Mm-hmm.
Yes, unfortunately, Mr. Hawrot, we're going to have to leave it there, but do come back. I'd love us to continue this conversation. Have a very good day. Thank you.
Thank you. Thank you.
And that's all from us in this episode of World Talks. Don't go away, though. Lots more coming up. Goodbye from me.